Hi, this is Zach, Katie, and Sabrina with Alpine Rescue Team. Today we're going to be demonstrating how to do a primary and secondary trauma assessment of an unconscious patient. Sabrina is our unconscious patient here. She fell 60 feet off rock climbing here and hit the ground, and she's now unconscious. We're going to start from the beginning. Before having approached the patient, I would have assessed that the scene is safe, looked for any hazards. Before I would have approached the patient, I would have also put on BSI, so you can see we put on gloves. I'd also consider putting on eye protection as well, depending on the situation. So that's that I have one patient here, and then I'm going to go on and, hey, you okay? You okay? Okay. Now I'm going to try to listen. Okay, so she's responsive to painful stimuli. That's all. Doesn't look like she's breathing. Can you take C-spine, Katie?
Yep.
We're going to go ahead and roll her over and get her airway open.
Can you straighten out this arm just a hair up here?
Right here?
Yep. Just put it up over her head. There you go. Perfect. Thank you.
Sure. On pads 3.
1, 2, 3. And I'm going to go ahead and open her airway with a jaw thrust without moving her head back. And it looks like she is breathing.
Okay, so now we have opened her airway. We consider putting in an airway adjunct potentially to help her breathe. And now we're going to look at her. She's breathing adequately, like Katie said. And go ahead and put oxygen on her as soon as possible. If you have enough oxygen, high flow oxygen at 15 liters per minute, if not 4 to 6 liters, the nasal cannula is sometimes more realistic in the backcountry. I'm going to go ahead and check her pulse. She has a strong regular pulse. Her skin's pale, cool, diaphoretic. I'm going to go ahead and that's potential signs of shock, so I'm going to treat for shock as well as consider her a high priority patient and try to get her out as soon as possible. After having addressed the ABCs here, I'm also going to consider additional resources as well, possible helicopter evacuation if I can get one in. If not, what we're going to need to get her out, a full body split, more oxygen, the litter, all that type of stuff as well. I can't get a sample history since she's unconscious. If at any point she starts to wake up, sometimes patients have moments of lucidity where they'll come out after a head injury. Take advantage of that, stop what you're doing, get a sample history while you can, and then you can go back to whatever else you're doing, but that's important. Since I can't do that right now, though, I'm going to go ahead and move on to my head to toe. Start with palpating her cervical spine. Okay, I don't feel anything there. I'm going to start to palpate all the cranial bones. I do feel crepitus in the occiput back here. Zygomatic, maxilla, and mandible. Look at her nose, look for any bleeding. Going to check her pupils. Okay. Looks like her left pupil is blown. And check for reactivity to the light. Does not react to light. I'm going to look at her ear, see if there's any fluid coming out. Blood, CSF. It does look like she has some clear fluid coming out of both her ears. So that's probably cerebral spinal fluid. Take note of that. Look at her throat, look for any tracheal deviation or JVD. Start to palpate her chest. Everything feels sturdy there. Palpate her abdomen. Keep in mind when you're doing a head to toe, even if it's an unconscious patient, look at their face while you're doing this. Sometimes they'll show signs of pain and that'll reveal an internal injury that you wouldn't otherwise have been aware of. Move on to her pelvis. Push in like that. A lot of times people are being trained to push in on the pelvis like this and then push out. That is something that is not good to do. All you need to do is push in on the pelvis like that. You'll either feel it fractured or you won't. Pushing out like this afterwards is only going to damage more vasculature in there if you do it. It doesn't gain anything in your assessment. We're going to go ahead and move down the arms here. Going to feel her pulses. Okay. Move down her legs. I do feel crepitus in her left leg here, so I'm going to cut that up and look at it. It looks like there's an open fracture here with the tib sticking out. Check pulses on both of her feet. Come down her other thigh. Feel it down there. Check pulses in all extremities. So let's go ahead and roll her onto her back.
Onto her side?
Under your side, excuse me.
And I've been monitoring her breathing throughout this Zach's assessment, and her breathing has stayed adequate. You ready to roll?
I'm
On
ready to roll.
3, 1, 2, 3.
Remember, the head always counts off. Now I'm going to start with her thoracic vertebrae, move down to her lumbar vertebrae. I do feel some crepitus right here, mid-lumbar spine, possible spinal cord injury here as well. I'm going to palpate everything medial to her spine as well. Okay. On your 3.
Down on 3, 1, 2, 3.
Okay. Alright, so this is a critical high priority patient. I've gone ahead and done my head to toe. I'm going to continue to reassess vitals as often as possible. Most medical standards say for a critical patient like this, you're going to do it every 5 minutes. That's not generally reasonable in the backcountry, but do it as often as you can, anytime that you can get in there and do it. Make sure you're continuing to monitor them. Continue to think of anything else that you may need that's been revealed as far as equipment that you need after I've done my head to toe. If I need a radio down, and say that I need something else additional to what I had said initially with resources, continue monitoring patient, and take them out. And that's all.